Welcome back. In this video, I'll help you to understand the stomach and peptic ulcers. The ulcers are small wounds in the superficial area of the mucosa, which is the inner lining of the stomach or the duodenum. If the ulcer is in the stomach, we call it a gastric ulcer, and if it occurs in the duodenum, we call it a peptic ulcer. Peptic ulcers are far more common. Normally, these tissues have special secretions that protects from these ulcers. These secretions form a protective layer. Any defect in this layer can cause an ulcer. The most common cause is the use of medications such as the NSAIDs or the non-steroidal anti-inflammatory drugs, or some bacterial infections like the infection H. pylori. There are some risk factors associated with gastric and peptic ulcers, like stress, either physical or emotional, consumption of alcohol or caffeine, smoking, and spicy food. These are simply risk factors and they do not cause the gastric ulcer themselves. The gastric or peptic ulcer can bleed, and if the patient vomits up this blood, he presents with a coffee ground appearance. But he can also swallow this blood and it presents in the other end, and we call this melena. A very important tip to differentiate between gastric and peptic ulcer is the pain associated with eating. If the pain increases with eating, this is likely gastric ulcer. And if the pain goes away when the patient eats, this is likely duodenal ulcer. For most cases, the patient can benefit from proton pump inhibitors, and if he has H. pylori infection, he requires the appropriate antibiotics. In some cases, we might do endoscopy as well. A very important tip for exams is that certain ulcers can puncture or perforate and cause bleeding in certain arteries. An ulcer in the posterior wall of the stomach can injure the splenic artery, and of course this presents with massive bleeding. On the other hand, peptic ulcers in the posterior wall of the first part of the duodenum can injure the gastroduodenal artery. These two arteries are very important for exams. And here's a small quiz. Which of the following surgical procedures is performed to repair a gastric or duodenal ulcer? And the answer is gram patch procedure. Alright guys, that's all I have, and thank you so much for watching.